My name is Rachel Carmichael, and I will be performing an exam of the gastrointestinal and abdominal system. So first I would start by washing my hands and putting on gloves and introducing myself to the patient. Hi, my name is Rachel, and I'm a nurse practitioner student, and we'll be performing an exam of your stomach today. Can you tell me your name?
Anna.
Anna, nice to meet you. So Anna, what I'm going to have you do is lift up your shirt, and I'm going to have you just rest your hands across your chest. Awesome. So first I'm going to start by just inspecting Anna's stomach. I'm going to notice that the skin tone is even and equal across her stomach. I don't notice any obvious masses, any nodules, any visible signs of abnormalities anywhere. I don't see any scarring, but I do see some nevi spread throughout her abdomen, but that's normal. So what I'm going to have you do next, Anna, is I'm going to have you lift your head just to assess for a hernia. Great, you can relax. So I don't see that test did not reveal any herniation anywhere. So we're negative for any hernias. What I'm going to do now is just listen to your stomach in all four quadrants, starting with the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, so when I listened, I didn't notice anything abnormal. The bowel sounds were not hyper or hypoactive. They were normal active. So what I'm going to do, which is normal, what I'm going to do now is listen to her arteries, starting with the aorta, and I'm going to locate them and palpate them before I listen. So the aorta, I'm going to listen. Renal arteries, iliac arteries, her femoral arteries. Okay, so when I listened, I did not notice any bruits whatsoever, which is normal. What I am going to do now is just percuss your stomach, just to listen overall. Okay, so overall I noticed resonance and tympany throughout, which is normal. I didn't notice any abnormal dullness or anything like that. What I'm going to do now, Anna, is I'm going to percuss your liver. And so in doing that, I'm just going to have you lift up your hands, and I'm going to have you take a deep breath for me. Okay, let it out. Deep breath for me again. Let it out. Okay, one more time. Let it out. Okay, and again. And let it out. Okay, so normal findings for liver span in an adult would be 6 to 12 centimeters mid-clavicular line, and then 4 to 8 centimeters the mid-sternal line, and Anna's liver was noted to be in this normal range. I didn't notice any abnormal findings whatsoever. And what I'm going to do now is just percuss your spleen. Okay, and I didn't notice any areas of dullness whatsoever, anything that would be indicative of splenic inflammation. So what I'm going to do now is just do some light and deep palpation. So I'm just going to feel your stomach. Any areas of pain or tenderness, Anna?
No.
Okay, now more deeply. Any areas of pain or tenderness?
Mm-hmm.
Okay, and I didn't notice any abnormal masses or anything that was out of the ordinary. What I'm going to do now is just try and palpate for your liver. And so what I'm going to have you do is take a deep breath for me, Anna. And then I'm just going to place my hands on your ribcage and you can let it out. Okay, and I felt just the slight tip of her liver, but not any liver enlargement, anything out of the ordinary. So what I'm going to do now is just assess for any gallbladder or liver inflammation. And so in doing that, I'll do what's called a Murphy's test. And so I'm going to place my thumb under your ribcage and have you take a deep breath for me. Let it out. One more time, deep breath for me. Let it out. Any pain or tenderness, Anna?
No.
Okay, and so she did not have any pain or tenderness, so no inflammation of the gallbladder or of the liver. So what I'm going to do now is just palpate for the spleen. And so I'm going to put my left hand under my patient's left back, and then I'm going to have her take a deep breath for me. And I'm just going to press down, try and feel for the spleen. Let it out, good. Okay, and I don't feel the spleen, and that is normal. It's normal to not be able to palpate the spleen, so there's no spleen enlargement whatsoever. What I am going to do now is just assess for appendicitis, and so locating first McBurney's point, which is in the right lower quadrant over the appendix, and then I'm just going to assess for any rebound tenderness first. Any pain or tenderness when I pull up? Okay, great. And then what I'm going to do next is do what's called a roving sign. And what that means is I'm going to put pressure in the left lower quadrant. Let up. Any pain or tenderness there? And it would be positive if there was pain or tenderness in the right lower quadrant. And so that was a negative test. We don't have any signs of appendicitis from that test. What I'm going to do now is move on to the psoas sign. So what I'm going to do, Anna, is I'm going to have you lift up your leg when I tell you, and I'm going to push against your leg, and just don't let me push against it, okay? Go ahead. Good. Let it down. Any pain or tenderness in that right lower quadrant? Great. Now what I'm going to have you do is turn to your left side. Good. And then I'm going to have you bend your leg and just pull back. Any pain or tenderness? No. Okay, great. You can go ahead and lay flat again. Now what I'm going to do is called an obturator sign, and so for that one, I'm going to bend your right leg at the knee, and then I'm going to internally rotate. Any pain or tenderness? Okay, great. And so that would all be negative for any signs of appendicitis. So Anna, what I'm going to do now is what's called a fluid wave test, and that is just testing for any ascites, any extra buildup of fluid in your stomach. And so I'm going to have you place your hands in the middle of your stomach, and then I'm going to place my hand on your left and right sides of your stomach, and I'm just going to lightly tap on the left side, look for any fluid shifting, and then lightly tap on the right side, look for any fluid shifting. And I don't see any whatsoever, and so don't see, you can relax your hands, Anna, I don't see any signs of ascites whatsoever. So now what I'm going to do is try to palpate the left and right kidneys. So starting with the left, similar to the spleen, palpating for the spleen, Anna, I'm going to place my hand under your left back, and I'm going to have you take a deep breath for me, and just let it out for me. Okay, so I don't feel the left kidney on that side, which is normal. Then I'm going to place my hand on her right back, and I'm going to apply pressure the same as I did with the other side as she takes a deep breath. Okay, let it out. Great, and I don't feel the right kidney on that side either, and that is normal. I did not notice any kidney enlargement. Okay, so Anna, we're almost at the end of our exam. What I'm going to have you do is sit up for me. And I'm going to have you face that way to the left just for purposes of this exam. Great. Now I'm going to locate your costovertebral angle, which is below your 12th rib, right there. And then locate it on the other side as well. So what I'm going to do is just exert a little bit of pressure with my hand by just pushing against your kidney, and let me know if you have any pain. Any pain?
No.
Okay. Pain?
No.
Okay, awesome. So that concludes the exam of the gastrointestinal system. Thank you so much, Anna, for letting me assess you today. I'm going to wash my hands, and then that will be the end of the exam. Thank you so much.